name is Stephanie Fraley, and this is my video over the description of the hip joint for Dr. Chanley's Human Anatomy course. I hope you enjoy. The hip joint is a ball and socket joint that is formed by articulation of the concave pelvic acetabulum and the spherical head of the femur. It is designed for stability and weight bearing more so than motion. The acetabulum is a cup-shaped depression in the inferolateral part of the pelvis, and the head of the femur fits inside of this depression. Both are covered in articular cartilage. There are four main ligaments of the hip joint. The first one is a ligament of the head of the femur, which runs from the acetabular fossa to the fovea of the femur, and this encloses the obturator artery. On the anterior aspect of the hip joint lie the iliofemoral ligament and the pubofemoral ligament. The iliofemoral ligament arises from the anterior-inferior iliac spine, and it bifurcates before inserting into the intertrochanteric line of the femur. This Y shape prevents hyperextension and makes this ligament the strongest of the four. The pubofemoral ligament spans between the superior pubic rami and the intertrochanteric line of the femur. This makes a triangular shape, which prevents excessive abduction and extension. On the posterior view of the hip joint, you can see the iliofemoral ligament and the ischiofemoral ligament. The final ischiofemoral ligament spans between the body of the ischium of the pelvis and the greater trochanter of the femur. It has a spiral orientation which prevents hyperextension and holds the femoral head inside of the acetabulum depression. The majority of the blood supply of the hip joint comes from the medial circumflex femoral artery and the lateral circumflex femoral artery. These are both branches of the femoral artery. The main innervation of the hip joint comes from the sciatic nerve, femoral nerve, and obturator nerve. The hip joint can undergo various actions from various muscles. The anterior thigh muscles do flexion of the hip joint, and these muscles include the iliopsoas muscle, the rectus femoris, the sartorius muscle, and the pectineus muscle. The posterior thigh muscles extend the hip joint. These muscles are the gluteus maximus muscle, the biceps femoris muscle, long head and short head, and the semimembranosus muscle that lies deep to the semitendinosus muscle. Also, some of these muscles do lateral rotation of the hip joint. These are the quadratus femoris muscle, the gluteus maximus muscle, and also the biceps femoris muscles. The muscles in the lateral portion of the thigh do abduction of the hip joint. These muscles include the tensor fascia latae muscle, the gluteus medius muscle, and the gluteus minimus muscle that lies deep to the gluteus maximus muscle. These muscles also do medial rotation of the hip joint. Only the anterior fibers of the gluteus medius and the gluteus minimus muscles do rotation, and the tensor fasciae latae muscle does medial rotation. Finally, the muscles in the medial thigh do adduction of the hip joint. These muscles include the adductor longus and brevis muscles, the pectineus muscle, which you can barely see, the adductor magnus muscle, and the gracilis muscle. Thank you so much for watching my description of the anatomy of the hip joint. I hope you learned a lot so that next time you can ace your exam.